Okay, today I want to talk about adrenal dysfunction, adrenal fatigue, adrenal exhaustion, adrenal whatever you want to call it. If you followed any of my posts or comments or anything on hormone imbalance, I frequently go to the adrenal glands. The adrenal glands have to be probably the most overlooked organ in conventional medicine and even sometimes functional medicine. The adrenal glands produce your hormone called cortisol. It's your stress hormone. Cortisol or your adrenal glands are considered the puppeteer. They direct your other hormones, they imbalance your other hormones, but they also restore the balance to other hormones. And so I frequently make a big deal of adrenal glands and adrenal dysfunction, especially in America. We are all chronically stressed, under or sleep deprived, and we are just not de-stressing enough, not taking enough time out to ourselves. Numerous studies have shown that Americans don't even use the vacation time that many times they are given. So let's talk a little bit about adrenal dysfunction, since I don't think I've done a video on adrenals in a while and it's really important to me. My name is Dr. Philip Oob. I'm a functional medicine doctor practicing in Austin, and we're going to talk about some adrenal dysfunction. I even have a graph to show you. So the adrenal glands, to recap, make cortisol. Cortisol is your stress hormone. So if you're running from a lion because it's trying to eat you, your brain is going to release excess cortisol. It's going to release adrenaline, but also excess cortisol for actually a few days afterwards, after a stressful event. The problem in America is that we are constantly stressed. Your body sees stress in any way. It doesn't matter if it's financial, if it's relationship, if it's metabolic stress, meaning you've got inflammation, if it's a toxicity stress. It doesn't matter. Whatever the stressor is, your body starts making more and more cortisol. The problem with hormones is the more you make, the more your body starts ignoring that hormone. So if it's ignoring the hormone, then to get the same effect, it has to make even more hormone. And eventually the adrenal gland maxes out at a certain amount of cortisol that it can produce every day. So I'm going to show you that here in this graph. So this person is adrenally fatigued. They have pretty bad adrenal dysfunction. And you can see that because the normal adrenal gland releases a lot of cortisol in the morning, and that's what you see here as far as the rise. And then as the day goes on, it slumps off and goes down, and then we go to sleep and we start all over again. If you look at this patient's results, those 4 dots that you see are their dots. Now notice in the morning they make some cortisol, but nowhere near enough to the green line. And then by 9 a.m. when they're supposed to be spiking, they still haven't made enough cortisol. And then by the end of the day, okay, the cortisol is not still really not making enough, but at least at average there. And then at the nighttime, they don't have any. It's completely gone. Now, that usually leads for pretty good sleep, but once again, it's an imbalance. If there's no cortisol, that means you're not going to get good sleep, but too high cortisol at night is also bad. So if you look at their graph, it's pretty flat all day long. It's supposed to be a spike and a fall, but instead it's just pretty flat. So that person is fatigued, groggy, the whole wired and tired. In the morning they're exhausted and fatigued, but in the evening they're kind of wired but can't go to sleep but tired, and so it really leads to this dysfunctional pattern. And it doesn't feel good. So we used to previously call this adrenal exhaustion or adrenal fatigue because the way it looks is the adrenal glands are not making enough cortisol. Well, it turns out that we were actually pretty wrong. It's actually that the adrenal glands are making as much cortisol as they can possibly make. They're maxed out all the time, and the body's actually breaking down the cortisol too quickly. So when you look over here at this graph, this is what they call the urinary free cortisones. This is the breakdown metabolite of cortisol. So the adrenal glands make cortisol, and then the body has to break it down into cortisone. And this is the same person and the same urine test. And what do you see? You see that they've got plenty of breakdown metabolites. And in fact, by 9 a.m., when they weren't making hardly any cortisol, they were supposed to be spiking, but they weren't. But now, they're actually making a ton. Let's see if I can get it in the center again. They're actually making a ton. It's way up here. It's off the graph. So what that's telling me is actually the adrenal glands are maxed out, but the body's learned that there's been so much cortisol for so long that it's learned how to break down the cortisol too quickly. So when it starts breaking down the cortisol too quickly, you start making excess cortisone, and cortisone has a little bit longer of a half-life, and it's a little bit weaker of a steroid or a cortisol. And so when you have too much cortisone for too long, then you end up in this adrenal dysfunction state. So the new naming of adrenal issues is adrenal dysfunction. And the reason why is because the adrenal glands are pumping out too much cortisol, not exhausted, not fatigued. They are not fatigued. They are pumping out as much cortisol as they can, but it's being broken down faster than it can be utilized. So this is similar to diabetes, I tell people, because if you're a diabetic, if you're a type 2 diabetic, not the autoimmune kind, then you've got too much sugar in your bloodstream. Your sugar's high, but you've also got too much insulin in your bloodstream. These are oxymorons. These are not supposed to be together. Insulin lowers sugar, so how do you have high insulin and high sugar? Those don't match. And the reason why is because that person's been eating so many carbs for so long that they've had to release more and more and more insulin, and the body starts ignoring the insulin as there's too much. So as the insulin starts rising, the body starts ignoring the insulin, and then the pancreas can only make X amount of insulin, and once it maxes the factories out, then the sugar starts to rise because that much insulin just isn't doing the job. So that's the same thing that happens with cortisol. You're making so much cortisol and you're breaking down into cortisone. You've got so many steroids floating in the system that you've actually created a cortisol resistance. So when you have a stressful situation, a job meeting or something you need to perform, you need to wake up and your brain needs to function, you might not function that well because you don't have the cortisol you need to operate. Even if you do have the cortisol that you need to operate, your cortisol is so resistant that it's not even going to do the job you need. So that's the basics behind adrenal dysfunction, excess cortisone, the adrenal glands maxing out on their cortisol. So I usually encourage people to use the word adrenal dysfunction instead of the older terms adrenal fatigue and adrenal exhaustion. So how do we treat adrenal dysfunction? Number one, I tell all my patients this: you can take as many herbs and supplements as you want until the cows come home, but you are not going to get better if you don't focus on removing stressors. I don't care if it's toxic people, if it's a toxic marriage, if it's a dysfunctional relationship with someone's, a coworker. You have to work on the toxic things around you that are causing stress. So if it's your mortgage, there's not much you can do about the mortgage other than work more. So why stress about the mortgage coming, or why stress about finances? You're letting those stressors affect your body. Every time you stress, you make more cortisol. So in order to lower that cortisol resistance, you have to lower the amount of stress. It's not any different than type 2 diabetes. Type 2 diabetes is easily reversible. If carbs equal insulin, then not eating carbs equals reduced insulin. Reduced insulin resets the insulin sensitivity, and then the diabetes goes away. Well, that's the same thing with cortisol. In order to lower your cortisol levels, you have to reduce the stressor, you have to reduce the input, and that's unfortunately mostly up here. There's a good book called Why Zebras Don't Get Ulcers. I forget who wrote it, but it's kind of a boring book. I don't really encourage you to read it. I read it. But it goes all through the system and talks about research and how stress affects every system of the body. The premise of the Why Zebras Don't Get Ulcers is that zebras live amongst lions. There's lions all the time that could eat them at any moment. Crocodiles, whatnot, can eat them at any moment. They're kind of a prey, not really a predator, right? They eat grass. But why don't they get ulcers? They've got plenty of reasons to stress. We don't even live around lions and alligators, but we're way more stressed than zebras, and we get ulcers all the time. So the idea is the perception of stress. A zebra's not stressed until a lion shows up and starts chasing them, and then they run like hell until they can get away, and then the lion's going to eat Bob, their friend, and then they can go back to grazing grass, drinking water with the lion in sight, and they're not afraid of that stressor anymore because they know that the lion is fed. So we need to be more like zebras. How do we be more like zebras is a tougher answer. But job number one for you is going to be to limit your daily stressors. So once you limit your daily stressors, the next step is to take active mindfulness or de-stress at least once per day. I tell my patients I need 30 seconds per day, every day, to do some sort of de-stress. I don't care if it's sitting on the carpet, I don't care if it's yoga, I don't care if it's watching a meditation video or playing some meditation song, music or something. It doesn't matter. You need 30 seconds of active de-stress to teach your body what lack of stress looks like. The other thing I use frequently is supplements, of course, with adrenal dysfunction. I like in my practice to use combination products, so people don't have to take like 10 different pills to treat one thing. And so the combination I found has been the most effective is something called Adren-All. It's made by OrthoMolecular, and it's got a concoction of different things. It's got the adrenal extract, eleuthera, rhodiola, schisandra, licorice root, and then some other vitamins in it. You don't have to look all those up. Just look up Adren-All and then look at the ingredient label if you don't want to get this product in particular but want those same components. Ashwagandha is my other favorite herb for adrenal dysfunction. It's not in the Adren-All, but you're welcome to add to. The Adren-All is always in the morning. Timing of the adrenal glands is really important. Cortisol is supposed to be high in the morning and low in the evening. So you use Adren-All in the morning to raise the cortisol and lower that breakdown of cortisol to cortisone. That's what licorice does. In med school, we were put the fear of God in us by licorice, that it can raise blood pressure and do all these terrible things because it reduces the breakdown of cortisol to cortisone. Yes, it can be bad if you're not going to work on your stressors and meditate and all that. So this is usually the morning supplement that I recommend for people. The other one I like is AdreneVive, and that one's in the evenings. That one's also made by OrthoMolecular. These are my sample bottles, that's why it's got a big X on it. So this one has ashwagandha, skullcap, eleuthera, rhodiola, L-theanine, and phosphatidylserine. These are great kind of anti-anxiety, mind downing, kind of regulating supplements. I frequently use L-theanine and phosphatidylserine just by themselves to reduce anxiety and reduce that worry component. So in the evenings, you're really supposed to be winding down, getting ready for bed, but if your mind is racing and racing and you can't go to sleep, if you can't get that high quality sleep, then you're just not going to feel better. So last, I'll leave you with what are some of the symptoms of adrenal dysfunction. The biggest one is fatigue. Fatigue. So if you're tired and you've been stressed all your life, or you just had a death in the family or bought a house or something or other, then you are going to be stressed. Your cortisol is going to be high. There's going to be some dysfunction if you don't reset those. And so number 2 is restless sleep. So frequently people will say, I'm so tired when I hit the bed, I'm just exhausted, I go to sleep, but I'm waking up like every hour or 2 hours, and I just don't wake up feeling like I got that deep rest because I'm waking up so frequently. Number 3 biggest symptom is afternoon fatigue. So if 2 or 3 o'clock hits in the afternoon and you are just exhausted and you're reaching for that cup of coffee or that Red Bull or something, then that's telling you that you probably have adrenal dysfunction. 3 other key components are sugar cravings, salt cravings, and low blood pressure. Now, not everybody has low blood pressure, but if you have low blood pressure and you're experiencing a lot of those symptoms, then you know you definitely have adrenal dysfunction. There's plenty of other symptoms going along with adrenal dysfunction, like brain fog and autoimmunity, and I could spend hours talking about adrenal dysfunction, but you're probably already tired of listening to me. So please, if you're suffering from any of those symptoms, try these supplements, herbs, and work on your de-stressing and meditation, and then of course research more. If you're not getting success, keep researching and look at what can help you. Balancing your hormones is the most important thing you can do for your health and vitality. So I hope this is helpful. Share it with someone who you know is stressed out, which is all of America, and maybe we can change the world.